السلام عليكم طلبتنا الأعزاء. هذه تكملة لمحاضرة التوث mobility. Tooth mobility can occur in two stages: the initial stage or the intra-socket stage and the secondary stage. We will return back to the initial stage. When this stage will happen? This stage or the initial stage occur when a small force, which is about 100 pounds, applied to the crown of the tooth. So the crown will start to tip in the direction of the force. The movement of the crown will be only 0.05 to 0.1 millimeter. This movement is called the initial tooth mobility, and it is intra-socket mobility. It means within the socket of the tooth. In this movement, there will be a pressure and tension zone. In the pressure zone, there will be 10% reduction of the width of the periodontal ligament, while in the tension zone, there will be a 10% increase in the width of the periodontal ligament space. As we can see here in this diagram, the force applied, a small force about 100 pounds applied to the crown of the tooth. The tooth will start, or the crown will start to tip in the direction of the force. There will be pressure zone and tension zone. In the pressure zone, there will be reduction of the periodontal ligament space, while in the tension zone, there will be increase in the space or in the width of the periodontal ligament space. The second stage is the secondary stage. In this stage, a large force, about 500 pounds, applied on the crown of the tooth. So the fiber bundles on the tension side cannot offer sufficient resistance to further root displacement. What does it mean? It means that the fibers of the periodontal ligament cannot withstand a further displacement of the root. This will lead, if this force remains, it will lead to tearing of the periodontal ligament fibers. This is called the secondary tooth mobility, and it is allowed by distortion and compression of the periodontium in the pressure side. يعني بالpressure side there will be compression of the fibers, while in the tension side the fibers will be tense until it may be teared if the force remain. What are the causes of pathological tooth mobility? We have local factors and systemic factors. From the local factors, first of all, is the bone loss or the loss of the bony or the tooth support. This is the most important factor that will affecting the tooth and make it mobile, is the destruction of the periodontium. Second is the trauma from occlusion. We know the trauma from occlusion is excessive occlusal forces applied on the tooth, and it will lead later on to mobility of the tooth. Hypofunctioning. And 4 is the extension of inflammation from the gingiva to the periodontal ligament. And 5, the periodontal surgery. And this condition, it occur temporary or it is transient mobility. Following the periodontal surgery, there will be increase in the tooth mobility, and later on it will be subside. Also the tooth loss, this factor also affecting the mobility of the teeth, because the forces will be applied on the remaining teeth if the large number of teeth is lost. Pathology of the jaws, like tumor, cyst, or osteomyelitis. Tooth morphology, as we know, the increase in number, size of roots, and more bony supports. All these factors affecting the mobility of the teeth. Also, we have overjet and overbite, or the spread of inflammation from the periapical area. Sometimes we don't have any inflammation in the periodontium, but the inflammation coming from the periapical area or periapical abscess. If there is any inflammation in the periapical area, then the inflammation will spread to the periodontium and start inflammation there, and mobility will be occur later on. While the systemic factors of the tooth mobility, first of all, the aging, we have many changes that is occur accompanied with age, like changes with periodontal ligament fibers. It decrease the number of the fibers, and any other factor is the sex and race. Mobility, it has been found more in the females more than males, and in niggers more than white people. Also, the mobility increase in case of hormonal changes, like in menstrual cycle, or patients taking oral contraceptive pills, or pregnant ladies, and other factors like the systemic diseases, like the Papillon-Lefebvre syndrome, Down syndrome, and Chidiac-Higashi syndrome, and etc. All these factors affecting the tooth mobility, and it will be increased. Classification of tooth mobility by Miller. We have three classes. Class 1, when the tooth move in a horizontal direction less than 1 millimeter distance, and class 2, when the tooth move in a horizontal direction more than 1 millimeter distance, and class 3, the tooth move in a horizontal and vertical direction more than 1 millimeter distance.